Well, I'm really excited to be here. When Bernadette asked me to give this talk about 2 months ago, I hesitated a little bit because I had to give a talk at Stanford Hospital this morning. And trust me, I'd much rather be here with you than with those doctors that I was stuck with this morning. So, having said that, we're here to celebrate retirement and to talk about retirement. And I went back, and believe it or not, I had my notes from 5 years ago, and things have really changed. Apart from the fact that I'm closer to retirement, all of you are probably thinking about it. So let me ask, how many people here are retired? How many people assume to be retired? Well, you know what? You're wrong, because you should never use the word retired, because we want to redefine what that means. So the notion that you're retired, you should stop saying that, because you're not really retired, you just transitioned into a different period. So I went to the dictionary, and I wanted to look up what the definition of retirement was, because it's a word that I don't want to use, and I don't want you to use. And it was to withdraw from one's position or to stop being active. Isn't that impressive? And I'm sure all of you who just described yourself as quote-unquote retired don't fill that definition. So what I'd like to do now is talk a little bit about what you can do to be active, to have fun, to have a good time, and to approach this transition into a new era with joy and hope. Because certainly, there have never been a time in our history when more people are doing it. If you retired in 1970, you lived about 4.5 to 5 years. What did you do? Most people stayed very inactive. They would go out to religious worship, and that was about it. They had limited contact, and very few people started new activities, even back in 1970, which you got to realize is not that long ago. So here we are now in 2014, and oh boy, have things changed. You know how long the average person is in retirement now for? 18 to 20 years, depending. I have a patient who is 104. She's been retired for 40 years. She's been retired more than she worked, she said. She never worked that much to begin with. And she said that every day is exciting to her, and she enjoys things so much. So I think the notion that this is just a short period, that you can't do things and have fun, could not be further from the truth. So retirement in this day and age, and that's the last time I'm going to use that word, is certainly a new beginning. It's an opportunity to develop new friendships, to embark on new activities, and to really get to the point that day to day, I'm going to enjoy things and get the most out of it, and not be hung up on chronological age, or kind of how we're feeling, but focus more on the positive things. Now, they did a recent survey, AARP did, and do you know what the #1 concern for people that are retired is? Money. And, you know, I can appreciate that and understand that, but the fact is that even in this day and age, most retirees are going to be able to manage and have the opportunity to do things. And contrary to what you might be hearing, I really don't believe that Social Security is going to go bankrupt in the near future. Certainly there have to be adjustments to that, but the opportunity to have some financial security, I think, should be there for everyone. And this can occur through various programs, reverse mortgages, and other such opportunities. So clearly, people that don't focus on the money issue, whether they have it or not, actually are going to live longer and enjoy their transition years better, okay? So let me talk about some of the important things you have to do to enjoy your transition. Once again, I'm not going to say retire. And clearly, coming to an event like this is one of the main ways you can do that. People have this morbid fear of developing memory problems once they retire. And there's actually been some data that has shown that as you get older, and if you quote-unquote stop working formally, you might have some more rapid decline in your memory, but I think a lot of that has to do with lack of keeping your mind active. So keeping your mind active in any way, whether it's attending sessions like this, whether it's going out and volunteering in the library and reading to children, whether it's volunteering in a hospital, whether it's playing bridge. By the way, I have a lady who plays she's in 4 bridge clubs a week. And she's concerned about her memory. And I told her, forget about your memory. I couldn't learn how to play bridge. So activities like that are really, really important. And going to senior centers, where it's not just sitting there and getting one of those prefab meals, which we all know what that entails. It means being active, taking classes and the like. So for instance, in Guilford and Madison, we have, programs where you have ongoing learning, continuing education. Certainly that is extremely, extremely important. Most colleges now have programs for people when they get older, and you can take courses at a much reduced rate. Now you might want to go for a degree, or you might just want to keep your mind active. And certainly online learning is really caught on. And a lot of those opportunities are offered free. So any way you can keep your mind active through cognitive activities is certainly going to give you the best chance to maximize this transitional period. So just remember that. Find a purpose. How many people wake up in the morning and say, what am I going to do today? A lot of people. It's been shown that you will live longer and be happier if you plan some activity each day. Now, it doesn't have to be dramatic. You don't have to run a marathon. You don't have to play, a softball game. It can be any little thing. But if you get up in the morning and have something to do, that is going to facilitate not only your activity for that day, but in the long run and in total keep you more active. So even if it's something minor, think about doing that. It could be volunteering. A study was written a couple of years ago that if you volunteer, you live on average 3 years longer. And it doesn't matter what type of volunteering. Why do you think that's the case? Well, it's the case probably because you're keeping your mind active and you're developing social relationships and interactions. And I should mention this other interesting fact. As you get older, the relationships that seem to help you age in a more positive way are those with non-family members. Now, isn't that interesting? Stay away from your kids, because they're like a problem. But coming to activities like this, where you're having friends around, has been shown to be actually much more important and valuable than just relying on your family. Now, I don't want to disparage family. It's obviously very important. But there's more to life than just babysitting and doing those family obligations, which is something really important. Think about starting a new relationships. People are getting married, forming relationships well into their 8th and 9th decade and beyond. And people are using that as a way to add value to their life and to develop more meaningful relationships. And that is extremely important. I used to hear all the time, somebody told me that their husband died 5 years ago, and I said, oh, are you in a relationship now? Have you thought about that? Oh, I'm too old for that. That's not the case now. Trust me. You can only but believe what is going on out there. And I'm not advocating unhealthy practices. What I'm telling you is enjoy the possibility and open yourself up to new relationships, whatever form that might take. Because it's been once again shown in research that people who develop relationships at whatever level, not with family members, are going to live longer and enjoy themselves their time more. Spirituality is very important, however you might define that. Whether you're going to a church or a synagogue, whether you're meditating, whether you're just thinking about the fact that there's probably some larger presence out there. Or as one guy told me, he's an atheist, and he thinks about that all day long. So I said, well, that's kind of a religious activity as well. So clearly, any type of religious involvement, spiritual involvement, has also been shown to be one extremely positive way with regard to aging. And you don't have to do anything that formal, but just kind of think about that. I want to also touch on something that is actually epidemic amongst people as they get a little older. And I'm going to talk a little bit about more health-related issues. I have to do that later because I am a physician. But depression continues to be epidemic amongst people, particularly as they get older. And some recent studies have shown that if you're depressed, you also have a higher chance of developing Alzheimer's disease, apart from other risk factors. So there's very good reasons, if you feel depressed, if you feel sad or down in the dumps, that you should discuss that with somebody. And there are some new, very safe medications. There's some wonderful counseling programs and opportunities. But I strongly urge you, don't sit there and live with these feelings of helplessness. Don't feel like you can't enjoy any activity, because depression is something that will not only affect you day to day, it'll reduce your enjoyment in this transition period, but it will actually shorten your life. So don't be afraid to question healthcare providers about that. I saw a patient recently who said to her primary care provider that she was depressed, and he said to her, well, what do you expect? You're 90 years old. And she then said to him, well, I expect I'm going to find a new physician. Absolutely right. Because if you get that response, then you've got to seek some other type of help. Because clearly, getting older and being depressed may go together, but you don't want that to impact on your transition years, because clearly it can, and it's very important. Physical activity is also important. If you walk 1 mile once a week, you will probably add 1 to 2 years to your life. Now that's not a lot of walking. And if you have other conditions like arthritis, visual problems, where you might be a little unsteady, it doesn't mean that should preclude you from doing some physical activity. Chair exercises, which is very popular in a lot of senior centers, it'll help build up your bone strength. That has also been shown to prolong your life. So any type of limited physical activity will actually make a big, big difference for you. And don't be afraid to try it. Obviously, you might need clearance from your healthcare provider. I wouldn't recommend starting running with a marathon, but certainly any limited physical activity, even though you may consider it very small, can make a big, big, big difference. And I would encourage you to think about doing that, even if it's something as simplistic as chair exercises. So while I'm talking about kind of more medical issues, let me just quickly go over a few things and dispel some myths. How many people here are on blood pressure medications? Don't worry, I won't look at you. So the use of blood pressure medications is obviously important. It is obviously can prevent, bad outcomes. But I think we're getting crazy in our society about the fact that everybody's blood pressure has to be 120/60. Very few people have that. And there's actually research going on now, led by Dr. Tanetti, who's our chief at Yale, showing that at some point, tight blood pressure control might actually do you more harm than good. Now, I'm not advocating you throw your blood pressure medications out. I don't want to get into trouble and get phone calls. But what I'm saying is every time you go to your healthcare provider, please ask them about, do I need this particular dose? Is this medication still indicated? And if your blood pressure is a little higher, actually, that might be better than if it's tightly controlled at 110/70. So that's something that has actually changed over the last 5 years. We used to think that you had to walk around with a low to low normal blood pressure, but now we know that that is actually a risk factor for falls, for fractures, and for other bad complications. So if you are on blood pressure medication, ask about that and try to be vigilant of the fact that maybe your blood pressure doesn't have to be that tight control. Now, I'm always reluctant to say maybe you should take your blood pressure at home, because we know that that's a much more realistic measurement than when you're in the physician's office. But I'm always reluctant to mention that because I have a lady who I said to her, just check your blood pressure a couple of times, and when you come back and see me, we'll go over it. And she came back with about 10 pages of blood pressure. And her husband looked at me and said, that's all she does now is take blood pressure. In fact, she's taking it on our 5-year-old granddaughter. So don't go overboard with blood pressures. And I think if you question the medication and realize that a blood pressure you might have been on when you were 60 or 70, you may not need when you're 80 or 90. And that's really important. Also, in a similar way, always question medications. Once again, as you get older, your ability to clear out some of these medications and to stay on the same dose decreases. So it's really, really important that if you're taking certain medications, number one, your primary healthcare provider knows the medications you're taking. Typical older people take about 6 to 8 medications, 3 to 4 prescription medications, and I'm going to go out on a limb and say probably a third of them are unnecessary. I see patients all the time that were placed on a medication 20 years ago, and everybody keeps reordering it, and nobody knows why they're on the medication. So it is really important to question the medications and make sure all your healthcare providers know all the different types of medications you're on, because I'm going to tell you a little secret. Doctors don't talk to each other that well. So you may be taking a bunch of medications that your primary physician doesn't know what your cardiologist is giving you, doesn't know what your rheumatologist is giving you, and the like. But with the advent of electronic medical records, that's becoming less of an issue. Another thing that you should strive to obtain is better sleep habits. And we know that people that have trouble sleeping don't enjoy their transitional years as much as people that don't. So the notion that you need a pill to help you sleep probably is not true. There are a lot of different opportunities to improve your sleep through non-pharmacological methods. And I have found that people assume when they get older that they need less sleep, or that they're going to be an insomniac, or that their sleep pattern should be dramatically different. Now, it is true, when you get older, the amount of time you spend in deep sleep tends to decrease. The amount of REM sleep, or that sleep where you have those crazy dreams or dreams, that may tend to increase. And you may actually awaken more during the night. But it doesn't mean that you should become an insomniac. It also doesn't mean that you should resort to using some cause. Is it that your legs are jumping around? Is it that you're getting up 6 times to go to the bathroom? Is it that your back hurts when you're lying in bed because of arthritis? So you want to look for reversible causes instead of just assuming that a pill is going to help. It's also been shown that if your sleep pattern is good, when you get older, you're going to live longer, but that if you take sleeping pills to attain a quote-unquote improved sleep pattern, you do not get that increase in longevity. So just think about that. And I'm sure if I asked, and I'm not going to, a third of the people in this room in the past year have taken some type of sleeping aid. And I would strongly recommend that you reassess that, you ask your healthcare provider, and you look for other reversible causes that might be affecting your sleep. Alcohol and tobacco. You're serving alcohol here, right? Which is great in moderation. I should mention that a recent study just came out where they looked at red wine and it's supposedly helping prevent heart disease, helping to prevent memory problems. Guess what? It didn't work. So it probably was not the wine, it was something else in that component it wasn't the alcohol, it was something else in that wine that was helping. Having said that, certainly anything in moderation is appropriate. But I have a gentleman who saw me because he was having memory problems and he drinks 6 scotch a day. And his wife said that's the only thing he can remember is to pour the scotch in the car. And I looked at him and I said, you really think that you have Alzheimer's and you're still drinking 6 glasses of scotch a day? Do you think there's any effect there? And obviously it was difficult, but he did cut back a little bit and guess what? His memory got better. So anything in moderation in terms of alcohol use is really important, as well as tobacco use. People say, well, you know what? I've smoked for years, I'm 90 years old, I've outlived the risk of getting cancer or emphysema or heart disease from smoking. And yes, to a certain extent that may be true, but if you cut down at any age, even a few cigarettes, you can add life to your years and certainly live longer. But what usually gets people most worked up is when I tell them, how much money have you spent on cigarettes? And I don't know, a pack of cigarettes is now $8, $7. Anybody here know? Nobody knows. Yeah, 2.6? What? I don't know what you're smoking, but. So clearly, cigarettes are expensive, and when people realize how much money they've spent on smoking through the years, that also tends to resonate with them a little bit. So I don't mean don't enjoy yourself. I'm not advocating smoking, although if you are smoking and you cut down a little bit, that's better than not doing anything. But any of these kind of risky behaviors in moderation, I think have been shown to not only prolong your life, which is one goal, but to make your transitional time even all the more exciting and important. Now, the other very, very important point that you have to remember is that there's never been more people at the stage of quote-unquote retirement than ever in our history before. The fastest growing segment of the U.S. population is now the 85 and above. So clearly the notion that 85 is old or that there's very few people attaining that, that's absolutely not true. Most people are going to now live even longer than that. So the thought that you should approach that by feeling I'm going to be alone, there's nobody who's going to be the same age going through this with me, could not be further than the truth. And the demographic kind of explosion that's occurring, where there are more and more older people, the baby boomers, I like to say it's more like baby zoomers. Because they're getting older, but they're zooming into those years with excitement and joy, and not just thinking about all the bad things that can happen. The other thing I want you to remember in terms of bad events as you get older, most of them will not occur to you. Now, people think about that. People say, well, you know, aren't the rates of Alzheimer's 50% or 40% when you get 85? Yeah, but it means that 60 or 65% of people are not going to get that problem. What about the rates of heart disease and cancer? Yes, obviously, as you get older, your risk of having those problems go up. But the majority of people will not be afflicted by that until well into their later years. And by later years, I mean 8th and 9th decade. What is the life expectancy now? If you're 75 now, you're probably going to live 8 to 12 more years if you're a man. And if you're a woman, maybe even longer than that. Women used to live on average 6 to 7 years longer than men, but guess what, guys? We're catching up. There's not that much of a difference now. It's now about 4 to 5 years. But the whole demographic landscape is going to change. As more and more people get older, the stigma with aging is going to go away. Because as this tremendously productive, active group gets to their older years, clearly the perception of what happens in those years is going to change. And we've seen that now already in our pop culture. Television shows, advertising, I mean, it seems you can't watch, you know, anything on TV where they don't have something about, you know, blood pressure medication, Viagra, all this other stuff. Why is that? Because your generation, the generation of people getting older, is pushing the envelope out there. And the notion that when you're 75 or 80, you're old and you're alone and there's not anything to do could not be further from the truth. And even over the last 5 years, when I gave this talk 5 years ago, that perception has dramatically changed. In terms of getting older and healthcare, geriatrics is actually now becoming a hot field. People may not believe that. Those of us that have been in it for a long time, when I first decided to go into geriatrics, people said to me, what, you're crazy? You want to be around older people? Now it's those very same people who are coming back and saying, wow, you got it. You were ahead of your time. What exciting time it is to not only take care of older people, but to try to improve the lives of older people. And rest assured, there is a lot that we can do to help you. So if you have any issue as you get older, I don't want you to think, oh, well, that's normal. Everybody, when they get to be 80, is falling, or is incontinent, or is having memory problems. That is absolutely not the case. So the bottom line message is, the more you do at the beginning of your transitional years will certainly serve you well as you proceed through those years. There's more people aging together, enjoying the experience and realizing that there's only but good times ahead. Now, obviously, there's going to be bumps in the road. Illness is going to occur. Loss of family and friends is going to occur. And I have a lot of older people that say to me, boy, getting older is great, I'm active, I do things, but I miss so many people that are no longer there. And obviously that's a reality. But treasure their memories and realize that they wouldn't want you sitting there being sad because they're not there, but they would want you to move forward and enjoy these years, which is with as much robust and vigor as you can. So I didn't say retirement. It's not retirement. It's redefining that transitional period. And rest assured, most of the people in this room will be active and healthy if they keep doing what they're doing now. 5 years from now, when if I'm lucky enough, Bernadette invites me to come back and to give another little talk. Because clearly there are wonderful opportunities to do that and to do it in a way that you can enjoy every single day. And I think that's the goal here. So once again, approach getting older with excitement. Realize that there are unparalleled opportunities. And most importantly, there are more people doing it than ever before. And certainly in a crowd that comes strength. And I think that's an important message that you should remember. Enjoy every day. It's an exciting time. And in fact, one recent study showed that most people enjoy their later years more than any other time because they're free of worry. They don't have to micromanage children and the like. And clearly, I want you to leave here with the notion that you can get as much excitement out of every day as you want to, and you can build on those life experiences. You know, it was George Bernard Shaw who said, too bad youth is wasted on the young. The converse of that is, thank God, when you get older, you realize what's happening and you don't have to be young anymore. And I think I want that to be the take-home message for all of you.